Is our skin saying more about us than we want it to? And how has cosmetic surgery grown?
A lot of skin resurfacing, microdermabrasion, chemical peels, injectables. You can go back to work the same day.
Yeah. You're gonna get older every day. Just live with it. It's gonna happen. Stop fighting it.
A pseudoscientific experiment tests how people react to Alice when her skin is soft and supple and when it's blotchy and bumpy.
Excuse me. I think I have something on my face.
Got black grease, like all this.
Oh, really? Is it pretty bad? Do you think you can get it for me?
Judy wants smooth, tight skin, not wrinkles. She considers whether laser resurfacing is right for her.
I like to look nice, I like to feel good, and I think when you look good, you feel better.
When I'm looking in the mirror right now, I'm thinking, I can't stand looking at these lines on my face.
Beauty is in the eye of the beholder, and trends come and go. But despite variations, healthy-looking skin is universally perceived as attractive. It's associated with youth, fertility, health, and fitness. Clear, smooth skin is always in.
Which means being known as pizza face will never help you get a date, not even in Italy.
What do these people do to improve the appearance of their skin?
I always wear makeup to improve the appearance of my skin as much as I can without it looking too overly made up.
I wear so much makeup for work that the best feeling in the world is to be able to go down the street with confidence wearing not a stitch of makeup.
I like the full-fledged makeup, the foundation, the blush, the works really, on a regular basis.
So how much do they spend for beauty?
To be honest with you, I probably spend no more than $100, $200 a year on skincare, even as a model.
My regular routine would probably cost me $300 every, I don't know, four months, something like that.
Well, I definitely spend a lot, more than I should.
I do actually use a lot of special creams. I spend a lot of money on moisturizers. I really like to be moist.
Psychotherapist Rebecca Rosenblatt speaks of the obsession with flawless skin.
Evolutionary psychologists state that men prefer women whose physical appearance gives an impression of fertility, smooth, youthful skin being one of the primary indicators, since it signals both health and vitality. As fertility declines, the skin starts to wrinkle. Small wonder many of us strive to make our skin look and feel its best, since we subconsciously learn a lot about each other by its appearance.
A pseudoscientific experiment puts it to the test. Is our skin saying more than we think it is? Alice takes her rollerblades and hits the park to find out. Alice gets a smudge of grease on her cheek. She'll ask people passing by for help.
Hi, excuse me. I need a little help here.
But what she really wants to know is, how close will people get when helping her?
Excuse me, sir. Do I have something on my face here?
Yeah, it's like you got black grease, like all this.
Oh, really? Is it pretty bad? Do you think you can get it for me? I was just trying to fix my skate because the bearing came loose.
No, it's not coming off. Here, wet your thumb and wipe like some spit onto it, and then I'll wipe it with it.
Okay. Is it making it worse or better?
It's going away.
Is it?
Most of it's gone. But
thanks so much. Okay. Thanks for your help. Bye.
Appearances can be deceiving. Does Judy's appearance reflect how she feels?
My appearance is very important to me. I try to look my best whenever I can. Even when I wake up in the mornings, I still put on a bit of makeup or whatever. When I go out, it's very important to me. I like to look nice, I like to feel good, and I think when you look good, you feel better.
When I'm looking in the mirror right now, I'm thinking, I can't stand looking at these lines on my face. It just makes me look older. My eyes make me look tired.
I don't think there's anything wrong in trying to improve yourself a little bit and make yourself feel better. And I worry because even when I was in my 20s, I worried about aging. And I used to think to myself, oh, I'm not going to handle this good. I know I'm not going to handle this good. And I'm not too bad, but there's certain things I look in the mirror and I just think, oh, if I could only go back in time and change this. So I think as far as that goes, it's going to give me more confidence, and I'm just going to feel better about myself.
Is Alice's skin getting positive feedback? She's tracking the reaction.
Do you think you could, excuse me, sorry to bother you guys. Do I have something on my face?
Yeah.
Yeah, is it a lot?
Like that much?
Do you think you could get it for me? Just my hands are just a mess. I think I'm gonna make it.
There, you're good.
Thanks, Mom.
It's all along here.
Right here?
Yeah, just up through here.
Oh, there.
Yeah.
And it's actually still, yeah, it's right on the bottom.
Do you think you could help me take it off?
Mom, if I licked my thumb and wiped your face.
I wouldn't mind if you did that.
So far, 7 people have touched her face.
Yeah.
Here?
It's pretty
Am I getting it?
Yeah, no, because your hands are dirty.
Okay.
Another
Spit, okay.
That's,
Oh, that's great, thanks. These guys with maternal instincts, cleaning me up good.
To rejuvenate her look, Judy seeks medical advice. She has an appointment with board-certified plastic surgeon, Dr. Tim Sproul.
Hey, Judy, how are you?
I'm good. How are you?
I'm very well, thank you.
Good.
So, well, what I want to know then is, what is bothering you about your face?
Well, these wrinkles, a little bit of wrinkling here, down around here, like a tightening or something that can remove.
We have a multiple number of different kinds of things we can do to tighten the skin and resurface the skin. They range from heals all the way up to some more invasive procedures like laser. And from my opinion's perspective, I think that laser is probably the best choice for you. But basically what happens to you is we burn the skin, it then heals. It will give you a permanent reduction in the wrinkles that you have. But you've also got kind of a lack of fatty tissue. And so I think you'd benefit from having that replaced. That involves simply aspirating a little bit of fat out of another part of your body.
Right.
And very carefully injecting them under the skin in a way that plumps up the skin. The combination really gives you a good result.
Okay, that sounds interesting.
There are potential risks with this surgery, like any surgery.
Here are 2 associated with laser resurfacing. Burns and scarring. Burns and scarring can be a risk from the heat of the laser's energy. Color changes. In 30 to 40% of people, especially those with darker skin, the treated area is darker than the surrounding skin. This may fade over time.
This is a significant injury to your face. It's something that is going to look terrible for probably about a week, and then you get that permanent effect.
So I should maybe bring a veil with me, Dave?
Oh, I think so. I think so.
Alice begins phase 2.
Time for the next transformation.
Many people touched Alice's flawless skin. Will reaction change with her new look? How much is our skin telling about us? And is it sending the right message? Collectively, we're spending a lot to look good, fueling the $160 billion a year international beauty industry. Yet many of us aren't giving our skin the very basics it needs: gentle cleansing, sunscreen, drinking plenty of water, eating a balanced diet, and using nutritional supplements when needed. Alice's skin is already clear and line-free, but a makeup artist gave her some extra help. Now, Alice's skin will be made up to look red and bumpy, with an added breakout. How will people react to her now?
Do I really have to go out looking like this?
Can flawed skin turn them off?
I guess hairy or wrinkly skin sometimes might slightly maybe turn me off a little bit, but I don't really want to admit it when it happens. So you see it and then you're like, can I block it? Can I not go there? Can I pretend it's not happening?
I think spots and wrinkles do turn me off. I feel like it's a sign that you're decaying.
I would find it more of a turnoff to encounter someone who supposedly looked really good, but who turned out inside to be a blithering idiot.
Blemishes can ruin anybody's day, mine and I'd say everybody else's for sure.
I do put makeup on my pimples, but some of them are just undefeatable. You know, it's like they've got a mind of their own. No matter how much you cake on, they're just, I will survive.
Yucky skin always turns me off. No matter how great their personality is, you can't really talk to somebody with your eyes closed.
I think flawed skin, you know, is something that a lot of people worry about. I don't know if it's really a turn-off, but that's all in the eye of the beholder. You know, if you can get some skin resurfacing and help that out, and that makes you feel better about yourself, then I definitely think it's worth it.
In part 2 of the entertaining social study, Alice's skin has gone totally textured.
The makeup artist did a really good job of making me look bad. It's funny, I'm a very confident person, but now, not so much. I'm not sure how people will react when my skin looks bad.
Will people still be as helpful? And will they touch her?
Many of us change our behavior based on how we feel the other person might think. Is she embarrassed by her skin? Does she not want me to touch it or even look too closely? So I think when Alice's skin is flawed, people will be somewhat hesitant about pointing out the problem.
Excuse me, sir?
So what is the reaction to Alice's new look?
Yeah, you have a bit of black.
Black?
Yeah, there. Exactly.
Right here?
No, it's a bit higher.
Higher? Here?
Down.
Here?
There. Yeah.
Okay.
It's a bit.
Big black smear right there.
Yeah?
Yeah.
Does it look pretty bad?
It's noticeable.
Thanks.
You've got a little bit of
Here?
Yeah. Like, are you having an allergic reaction?
Here?
Yep.
You think you can get it for me? What if...
I'd rather not.
All right. Nobody wanted to come near my face. If someone were looking the way I look now, I would like to think that I would wipe something off their face.